Hi everyone. The commercial I saw was for a newly approved medication called Breo Ellipta. It is advertised to be used for chronic obstructive pulmonary disease, or COPD. It is a combination dry powder inhaler containing a long-acting bronchodilator, or a LABA, called vilanterol, and a low-dose corticosteroid called fluticasone. The television commercial regarding Breo Ellipta can also be found on YouTube for reference. This commercial shows several people that state their names and state that they have COPD. It's kind of like a support meeting. My name is Melanie and I have COPD, that kind of thing. They state that they asked their doctor about Breo so that they would be able to do the activities that they wanted to do. The commercial has a voiceover that states that once daily Breo can increase airflow from the lungs for 24 hours. It also states that Breo prevents flare-ups that may need antibiotics or steroids or hospital stays. The commercial states that Breo is approved for COPD, although it has a component in it that is known to increase risk of death in patients with asthma. However, it is not known if this risk is increased in patients with COPD. The commercial states that Breo is not to be used as a rescue medication, nor does it replace a rescue medicine. It is not to be used more than once per day. The information in the commercial is consistent with the package insert, or the PI, but it is very abbreviated and, of course, put into a layman's language. The commercial does not state that a component of Breo Ellipta carries a black box warning from the FDA. It does state that a component in Breo carries an increased risk for asthma-related death, but it is not known about the risk for those with COPD. The long-acting bronchodilators, or LABAs, do carry the FDA black box warnings related to an increased risk of asthma-related death when they are used alone. The information in the PI contains more specific details regarding potential side effects and states that careful consideration should be given before prescribing Breo Ellipta to those patients with heart disease, high blood pressure, seizures, liver disease, glaucoma, or those that are immunocompromised. This may be related to the corticosteroid component as well as the LABA. The commercial does not state that those with severe milk allergy cannot take Breo Ellipta, as the powder contains a lactose protein, which is related to milk. Health education for the patient is advising the patient to call their provider if their breathing worsens while taking Breo Ellipta, or if they are needing to use their rescue medication 4 or more times per day for more than 2 days at a time. Side effects are any symptoms that are reported by patients during the study. The most commonly reported side effects do include a runny nose, a cold, a headache, or thrush, which is an overgrowth of yeast in the mouth. This is easily treated with a short-term medication and is preventable by rinsing the mouth after using Breo. The black box warning applies to the long-acting bronchodilator component of Breo. A study was done for asthma patients that demonstrated a small increase in risk in asthma-related death for those patients using LABAs alone. Subsequent studies did show that the addition of an inhaled steroid to treat the inflammation in asthma decreased this risk, and this may be why Breo has the low-dose steroid component. My personal position on advertisements is similar to how I feel about information on the internet. There is a lot of information out there. It needs to be screened. Some of it is relevant and applicable to the patient, and some is not. It is important that the patient feels comfortable enough with their provider to ask questions about information they have heard on both the television and the internet. This is so that the provider can address this information and provide applicable education. The provider is there to work with the patient. We must be able to provide options and choices for treatment, as well as provide realistic information about the benefits, risks, and potential costs of a medication as it applies to the patient. It is reasonable for a patient to ask their provider about the information that they find via the media. It would make me happy if a patient was asking questions about what they've heard about, because this shows they are comfortable with me as a provider, and it demonstrates that they have been able to ask questions about what they have heard, and it shows that they are interested in improving their own health. This dialogue may also bring up goals or challenges that the provider may not have been aware of. A patient with COPD might be worried about being able to keep up with their grandchild at the park, or even being able to carry groceries inside without becoming short of breath. The important thing to remember is that these are advertisements, and the goal of advertising is to sell a product and not to evaluate and treat a patient. Therefore, having an open dialogue with your patient allows them to bring the questions and information to you so that you can evaluate and decide if potentially their new medication request might be applicable to them. This was all about the Brio ellipta. Thank you for watching.